talk, I will focus on the last part of this co-creation phase that I just announced you before. So my colleagues just explained those the existing evidence on office office settings to learn about them, and also the qualitative piece related to the needs of those end users, and also the perspective of the employers. So I'm going to explain how we put, well, not how we put all together, but what was next in terms of advancing in to get the final Click to Move program that I'm going to explain to you in a couple of minutes. So we did a Delphi study, which is a methodology to get consensus related to a topic, in this case, putting together all these elements, digital elements that we found to be more effective in terms of the literature review, and also the work strategies, the physical activity interventions that have been described as potentially effective. So putting all this together with the perceptions of the stakeholders, we asked to experts, so experts on physical activity and occupational health, to comment and discuss about them, asking for the transferability of these office work strategies and behavioral technology elements to be implemented at the home office context. So we asked to 29, well, actually we asked to 57, experts, and we got answer about a half of them. So 29 experts around, internationally, actually we got representatives from Australia, Europe, United States as well. So 29 of them were involved through all the Delphi study, which consists on 3 rounds, 3 survey rounds, and a final focus group for this final discussion. So the first round, we asked them for the potential feasibility of the workplace policies that we identified before, and also covering the potential usability or usefulness of the digital elements to mediate those strategies. So once we got all the information from this round, we choose, or we include to the next round those strategies that were considered more feasible, potentially more feasible, and also the digital elements potentially more usable to mediate those elements. So in this second round, we ask experts for validation. So they already said which elements would be more what they recognize as more, but as potentially more transferable at the home office context. So at this second round, what we asked was about the validation of those, as well as a ranking of the 10 top elements that they would recommend. And following to the last round, we asked about a match. So which digital elements could be used to be more effective in order to implement the different intervention strategies. So finally, we also asked them to discuss about their this consensus, to discuss about their opinions related to these elements, and what it came up it was a list of a combination, sorry, about these digital elements on the your right side, left side. That's the other way around. Okay, in combination with the work strategies, so we could see and many elements and words just came up before. As you can see, the mobile phone application and desktop applications for covering prompts, schedule breaks, also creating an action plan, reporting feedback, the activity trackers, especially wristband activity tracker for self-monitoring for this passive data collection that it is mentioned before, gamification as a functionality, a technology functionality for rewarding incentives to make challenges, social challenges especially for this aspect that also Alan mentioned about the insulation. So these social elements from the home perspective, or working from home perspective is also important. And other combination of media such as video or emails for the educational materials, motivational messages that also was mentioned here. And all of these elements and intervention strategies were framed in this multi-component that came many times before to this multi-level framework, including individual strategies, but also physical, environmental strategies and support strategies, or social support, bringing from the top down, but also among equals. So don't worry about all of these words. It's just to show you that what is the logic model for the click-to-move program that comes from the different co-creation actions. And we put all this information to design this program at these 3 levels that I'm already mentioned, based on different theoretical frameworks. We can send to you all this material so you can have it, because it's that is difficult to read it. So this is the Click-to-Move program. It's a digital multi-component intervention for reducing and breaking prolonged occupational sitting time among hybrid office workers, based on a mobile phone application as a software, as the main software, and activity tracker, as you can see on the corner. Here you can see also in this diagram the different levels of the programs at the individual, organizational, and environmental level, starting from the darkest, here the individual, strategies such as educational material, feedback provision, active strategies such as those exercises that we propose for the active breaks, video demonstrations. So what mentioned Alan before show us how we can do it. So we all know that we have to stand up more, but what can we do? Self-monitoring at the organizational level, we have all these elements that involve the company or also the other workers, such as motivational messages coming from the managers, direct contact to the company, emails as a way of, we know that maybe it's not the most effective if you just send a PDF, but I'm going to show you in a minute the kind of these flyers or leaflets that we send with these key messages to the employees, and other more environmental elements such as the activity tracker itself, social chats, challenges, and the sensory reminders. So just a brief note about some of these functionalities. The activity break prompts was sent through, well, was self-reported, was monitored with a bracelet like this one. Participants receive for every hour of inactivity a vibration. Then they realized they knew that they have been 1 hour without movement, and they receive a message screen pop up with this message. It's a sedentary reminder: you have been sitting for 1 hour without movement. If you want to break your sitting time, just click to move. So the employee, so the participant can decide move at that point or just ignore that message. And we created that ignore part because maybe if I'm in a meeting, I'm not allowed to move at that point. So this message had been had appeared again with a delay of 30 minutes, just in case you want to, but you can't. Yeah. So if you click to move, yes, I'm ready. I'm prepared for doing that break. Then the strategy, the activity, the exercise proposed appear on the screen with the image, a description, and a video showing how to do it. And also not only how to do it, but the time and the repetitions and the specific instructions on how to do that exercise. So the feedback was provided on the home page of the app through you can see here 24 hours. It's a kind of loop of 24 hours, but only through the working time. Yeah, because every participant, so every employee can settle the working hours on its own profile. And here you can see, or the participant can see the time that you spend sitting, the time that you spend sitting for less than 1 hour, for more than 1 hour, and also the time that you are moving around. On the green bars are for the periods of times that you are moving around. The yellow ones that you've been sitting for less than 1 hour, about what we can consider short or medium bouts of sitting time, and the red bars for sitting for more, so prolonged sitting. And you can see also here this tick, green tick, which is that the reason is because in that moment you accept a strategy. So you did an active break. You've been sitting for more than 1 hour, or just for 1 hour, and then you receive a sensory reminder and you accept, and probably you did the active break. In the other occasions, then you delay and you never accept it. So what else you can see here the activity history, and then the social chat and the challenges proposed. So for example, a challenge to stand up every hour, and then you can see the number of breaks that you have to get as a target, in not only individually but also together with your colleagues. Participants also receive daily motivational messages in case they don't receive any sensory reminder. Maybe I'm a really sitting breaker. So in that case, they receive this congratulation message like, you are doing well, keep going. Also, we have this screen to contact the company. Participants use this kind of feature, especially for saying, I don't like this kind of challenge. I cannot get it to the aim. Or for example, we have messages related to the strategies that they like the most or not, or the other way around. So it's potentially, we are gonna evaluate everything and we can tell you more in some month, but it's been used for this kind of reasons. And finally, the educational materials that we mentioned before, we send by email these leaflets with the topics that we realize that matter to the employees on this qualitative study before. So there are 2 of them, but we have 1 leaflet for each, so 1 infographic for each month. We also, on these emails, part of this information, we also ask them for just general how you are doing. I mean, for general this perception about the program. So a part of what I was explaining to you, we are implementing this program and evaluating the program at the moment. The participants for this implementation were at the beginning 159 home office workers across 4 European countries. We have in Spain and the Netherlands, Ireland, and Slovenia. So all of these countries has 2 groups. So we developed a randomized controlled trials. This is for this evaluation we are doing this evaluation through a randomized controlled trial by clusters or departments. So in each country we have an intervention group and a control group, meaning that the intervention group was those employees who follow all the functionalities of the Click to Move program, and the control group, they follow the usual practice as they did before. So what we assessed for all of these employees was the behavioral outcomes through the device measures, also questionnaires related to occupational sitting time, standing, stepping, bout, transitions, also moderate to vigorous physical activity and light physical activity to get an idea of the overall patterns for these employees, and also related to what Karen said, how this behavior can mediate different health outcomes. So we also are measuring musculoskeletal health, pain, and general health. Related to work-related outcomes, we are measuring absenteeism, presenteeism, occupational fatigue, and job satisfaction. And this is all about the effectiveness, the impact of the Click to Move program, but also we are measuring, or we are assessing the process. So how is implemented and how is accepted and feasible at the end of the day. So all these outcomes have been measured at baselines in March 2024. And we have different follow-up periods at 3 months, 6 months, and here what we are at the minute. So we have the last measurement period in March 2025. So hopefully we get there in the same success that we are at the minute. And here I want to say something related to what you asked before, this discussion that came up before related to, is the environmental So the environment where you are working make an impact on your musculoskeletal health. So actually, for the thesis of Alan and Iris, we are studying these elements, and we have data. We haven't analyzed yet, but we have data for doing so. So here in this demographic information, we ask for the environment, where you are working at home, what are the conditions, and different elements related to the environment. So we can tell you more about that hopefully in some months. Okay, so finally, just to conclude, we really believe that the Click to Move program will provide valuable insights to inform policies, so policy guidelines and the development of future digital interventions to mitigate prolonged sitting time and addressing the associated effects of health and work-related outcomes within this new work paradigm. And so the last question to you is, why can we move just with one click? Okay, so thank you very much.